Hello, my name's Paul Hambleton. I'm a systems engineer in the Cisco UK healthcare team. Today I'm just going to spend a couple of minutes demonstrating how Cisco collaboration can enable patients to easily and securely connect to clinicians via high quality video. So this could be used in a GP surgery, hospital outpatients or a care home. So the patient gets sent an email which contains details of their appointment and a link that's unique to them and only valid for the duration of the appointment, plus a bit of time in case the clinician's running late. So clicking on that link is going to open up their web browser and present them with a self-view so they can check that they're looking good, and also a big green call button. So there's no sign-in process, accounts to create, passwords to remember or anything like that. Once they've clicked on the call button, the first person they're going to see will be a receptionist or clinic clerk. The receptionist will quickly check that the audio and video is working, make sure the lighting's okay, explain the process to the patient, and also answer any questions that they might have. The receptionist is then going to place that call on park. Video on hold is then played. So as an example, this is the Change for Life Food Smart advert from a couple of years ago, but it can be any video or series of videos that your trust has created. When the clinician's ready, they can retrieve that patient from park. And if multiple patients are waiting, then the clinician can choose who they would like to see next. So that's the view that the patient gets. If we rewind that, we can take a look at what the receptionist and the clinician are doing in the background to make that happen. So again, we start out with the email, and if I just overlay the receptionist's PC screen up at the top right there, we'll be able to see what's going on behind the scenes. So as soon as the patient presses the call button, the receptionist is going to get a notification on their PC screen so that they can answer the call, check the audio, video, etc. They're then going to right-click on the call and select Park or use the keyboard shortcut. And now the patient's going to be getting video on hold. And we should be able to see the patient's name in that parked call section up at the top right there. Now, of course, the reason that we know the patient's name is because the link that we sent to them in the email at the beginning is unique to them. So now let's look at the clinician's PC screen. The names of all of the people in the virtual waiting room are going to appear in that parked calls list up at the top right. And the clinician can choose to see them in any order just by clicking on their name. Also, during the video call, if the clinician wants to share their desktop screen with the patient, so perhaps an X-ray, then this is possible.